Hey everyone, Dr. Mike here. I'm excited to talk to you about a condition that, while it may sound a bit intimidating, is actually quite manageable. Today we're diving into the world of Gilbert syndrome, a condition that many people have but few know about. This is a genetic condition that affects the liver, an organ that plays a crucial role in detoxifying our bodies and processing various substances. Don't worry though, it's generally harmless and doesn't usually interfere with your daily life. In fact, many people with Gilbert syndrome don't even know they have it. They live their lives without any significant issues. Gilbert syndrome is characterized by slightly higher levels of bilirubin in the blood, which is often discovered during routine blood tests. Bilirubin is a yellow pigment that's produced during the breakdown of red blood cells. It's a normal part of the body's process of recycling old cells. The liver usually processes bilirubin and removes it from the body, ensuring that it doesn't build up to harmful levels. However, in people with Gilbert syndrome, the liver doesn't process bilirubin as efficiently, leading to a slight increase in its levels. This can lead to mild jaundice, a condition where the skin and whites of the eyes take on a yellowish tint. This can be more noticeable during times of stress or illness. Don't be alarmed if you notice this. It's usually temporary and nothing to worry about. Most people with Gilbert syndrome experience no serious health problems. We'll discuss the symptoms in more detail later, but rest assured, they are typically mild and manageable. Now let's delve into the genetic underpinnings of this fascinating condition. Understanding the genetic basis can help us appreciate why it occurs and how it is inherited. So, what exactly causes Gilbert syndrome? The answer lies in our genes. Gilbert syndrome is caused by a mutation in a gene called UGT1A1. This gene provides instructions for making an enzyme called UDP glucuronidyltransferase. This enzyme is crucial for processing bilirubin in the liver. The mutation in the UGT1A1 gene leads to a less active form of this enzyme. As a result, bilirubin isn't processed as efficiently, leading to its buildup in the blood. This genetic mutation is relatively common, affecting about 3% to 10% of the population. That's right, millions of people around the world have this condition. Now let's see how this mutation is passed down through families. Gilbert syndrome is inherited in an autosomal recessive pattern. What does that mean? It means that a person needs to inherit 2 copies of the mutated UGT1A1 gene 1 from each parent to develop the condition. If a person inherits only 1 copy of the mutated gene, they are considered a carrier. Carriers usually don't have any symptoms of Gilbert syndrome. However, they can pass the mutated gene on to their children. Now that we understand the genetics, let's move on to the symptoms of Gilbert syndrome. As mentioned earlier, many people with Gilbert syndrome don't experience any noticeable symptoms. However, some individuals may experience mild jaundice, particularly during periods of stress, illness, or fasting. Jaundice is characterized by a yellowing of the skin and the whites of the eyes. This happens because of the increased levels of bilirubin in the blood. Other symptoms of Gilbert syndrome can include fatigue, abdominal discomfort, and loss of appetite. It's important to note that these symptoms are usually mild and tend to come and go. However, if you experience any of these symptoms, it's always best to consult with your doctor to rule out any other underlying conditions. Section 5. Common triggers of Gilbert syndrome. Understanding these triggers can help manage the condition more effectively. Certain factors can trigger or worsen the symptoms of Gilbert syndrome. Recognizing these factors is crucial for those affected. These triggers can vary from person to person, but some common ones include fasting or skipping meals. When you skip meals, your body lacks the necessary nutrients to function properly. When you fast, your body breaks down more red blood cells, leading to an increase in bilirubin production. This can cause a noticeable spike in jaundice symptoms. Dehydration, not drinking enough fluids, can also concentrate bilirubin in the blood. Staying hydrated is essential to keep bilirubin levels in check. Illness, infections like the common cold or flu, can stress the liver and worsen jaundice. It's important to manage these illnesses promptly. Stress, both physical and emotional stress, can trigger symptoms. Practicing stress relief techniques can be beneficial. Strenuous exercise, intense physical activity can also increase bilirubin levels. Moderation in physical activities is key. Some medications can interfere with the liver's ability to process bilirubin. Always consult with your doctor before starting new medications. If you have Gilbert syndrome, it's helpful to be aware of your individual triggers and try to avoid them as much as possible. Keeping a health diary can help track these triggers and manage symptoms effectively. Section 6. Diagnosing Gilbert syndrome. Diagnosing Gilbert syndrome typically involves a combination of medical history, physical examination, and blood tests. Your doctor will ask about your symptoms, family history, and any medications you're taking. Blood tests will be ordered to measure the levels of bilirubin in your blood. A genetic test can also be done to confirm the diagnosis by identifying the mutation in the UGT1A1 gene. It's important to note that Gilbert syndrome is often diagnosed incidentally during routine blood tests. This is because the symptoms are usually mild and may not prompt people to seek medical attention. Section 7. Living with Gilbert's syndrome, treatment, and management. The good news is that Gilbert syndrome is a benign condition that doesn't require any specific treatment. Most people with Gilbert syndrome live normal, healthy lives without any complications. Management of Gilbert syndrome primarily involves lifestyle modifications to avoid triggers that can worsen symptoms. This includes staying hydrated, eating regular meals, getting enough sleep, and managing stress. In some cases, your doctor may recommend avoiding certain medications that can interfere with bilirubin processing. Let's delve deeper into lifestyle modifications in the next section. Section 8. Lifestyle modifications for Gilbert syndrome. Gilbert syndrome is a common, mild liver disorder that can be managed effectively with some simple lifestyle changes. Making simple lifestyle changes can go a long way in managing Gilbert syndrome. Here are some tips to help you live a healthier life while managing this condition. Stay hydrated. Drink plenty of water throughout the day, especially during periods of increased activity or hot weather. Hydration helps your liver function more efficiently and can reduce the risk of bilirubin buildup. Eat regular meals, don't skip meals, and aim for a balanced diet with plenty of fruits, vegetables, and whole grains. Regular eating patterns help maintain stable blood sugar levels, which is beneficial for liver health. Get enough sleep. Aim for 7 to 9 hours of quality sleep each night. Adequate rest is crucial for your body to repair and regenerate, including your liver. Manage stress. Practice stress-reducing techniques like yoga, meditation, or deep breathing exercises. Chronic stress can negatively impact your liver function, so finding ways to relax is essential. Avoid alcohol. Excessive alcohol consumption can put extra stress on your liver. If you choose to drink, do so in moderation and be mindful of your liver's health. Exercise regularly. Engage in moderate intensity exercise most days of the week, but avoid overexertion. Physical activity helps improve overall health and supports liver function. Remember, these lifestyle modifications can not only help manage Gilbert syndrome, but also contribute to your overall health and well-being. By making these changes, you can lead a healthier, more balanced life. Section 9. Prognosis of Gilbert syndrome. The prognosis for individuals with Gilbert syndrome is excellent. As mentioned earlier, it's a benign condition that doesn't affect life expectancy or overall health. Most people with Gilbert syndrome experience mild or no symptoms and lead perfectly normal lives. With proper lifestyle management, symptoms can be minimized or even prevented altogether. It's important to remember that Gilbert syndrome is not a disease but a genetic variation. Let's move on to discuss some potential complications and considerations. Section 10. Potential complications and considerations. While Gilbert syndrome is generally harmless, there are a few potential complications and considerations to keep in mind. Medication sensitivity. People with Gilbert syndrome may be more sensitive to certain medications that are processed by the liver. It's crucial to inform your doctor about your condition before taking any new medications. Increased risk of gallstones. Some studies suggest a slightly higher risk of developing gallstones in individuals with Gilbert syndrome. Psychological impact. Although rare, some people may experience anxiety or stress related to the diagnosis or the possibility of jaundice. It's important to have open communication with your healthcare provider to address any concerns or questions you may have. Section 11. Conclusion: Gilbert syndrome, a benign condition. In conclusion, Gilbert syndrome is a common inherited liver condition that's generally harmless. It's caused by a mutation in the UGT1A1 gene, leading to a less active enzyme involved in bilirubin processing. While some individuals may experience mild jaundice, fatigue, or abdominal discomfort, many people with Gilbert syndrome have no symptoms at all. Lifestyle modifications such as staying hydrated, eating regular meals, and managing stress can help prevent or minimize symptoms. Remember, Gilbert syndrome is not a disease and doesn't require specific treatment. With proper awareness and management, individuals with Gilbert syndrome can live long, healthy lives. If you have any concerns, don't hesitate to reach out to your healthcare provider. Stay informed and stay healthy.